Hi, this is Robert Carlson with Brave Defender Training Group. I want to thank everybody for taking a couple minutes out of your day and watching this video and hopefully gaining some critical information that's going to make you a better officer to serve your public, your partner, and your agency. What I'm going to talk to you about today is going to be an overview of the Tactical Emergency Casualty Care System, or TECC for short, and how it relates to the tactical medicine that as law enforcement officers we need to know how to do. Now, the TECC program is based upon the military's Tactical Combat Casualty Care, or TCCC program. The TCCC is kind of the basic standard baseline knowledge that all service members across all the branches of service need to have in order to deal with the most common trauma injuries that are encountered on the battlefield. Now, part of the TCCC program was they conducted a study on what were the leading causes of death on battlefield injuries, or what we define as tactical trauma. And in that study, they identified the three leading causes of death that were determined to be preventable, meaning that the initial responder that makes contact with the victim, if they do the proper medicine at the proper time, they might be able to influence the patient's survivability from these injuries. So the leading cause of death that was identified in that study was massive arterial bleeding from the extremities. The second leading cause of death was going to be from tension pneumothorax, or a buildup of air inside the chest cavity that compresses the lungs and inhibits the patient's ability to breathe and transfer oxygen. And the third and final cause of preventable death was determined to be from some sort of airway obstruction or airway compromise. This could either be from the casualty's own tongue falling against the back of their throat, blocking the airway, or some form of foreign object that was obstructing the airway. But these are the three causes of death that any good tactical training program is going to focus on trying to treat, because they're the only causes of death that we're able to influence at that initial first responder level. Now, when we look at the differences between the military's TCCC and the civilian TECC program, there are several similarities between the two operating audiences. One of the leading ones being that both military and law enforcement are potentially going to be exposed to hostile fire while they're trying to treat casualties. So we need to know how to deal with a tactical problem while simultaneously dealing with a medical problem. Both of us are going to be operating in periods of reduced illumination, meaning we may not be able to see the extent of our injuries or what we're doing. So we need to make sure that we are trained in being able to provide medicine where we may not be able to see all of our actions. We're also going to be operating in unfavorable operating environments. We could be working in periods of extreme heat or extreme cold. It could be raining out, it could be snowing out. These are all environmental extremes that could inhibit our ability to apply medicine. And so we need to make sure that not only the training, but the equipment we use is able to work in these kind of extremes. We're also going to have access to very limited equipment. We're not going to have an entire ambulance of resources available to us, and so in most scenarios we are going to be limited to only the medical equipment that we have on our body at the time of the injury. And this is especially true when we talk about dealing with injuries on ourselves in a tactical scenario. There's also a similarity in wound patterns. A gunshot wound that the military sees in a combat zone is the exact same type of injury that law enforcement sees in gunshot wounds here in the United States. So being able to treat those injuries is common between both environments. And then both the military and law enforcement need to have a good tactical recovery plan, because we're going to need to factor in and figure out how we're going to move this casualty off of the point of injury while simultaneously providing security for both ourselves and our casualty. So there are a lot of similarities between these two audiences. However, there are also a lot of differences as well that we need to factor in when we look at what type of medicine that we are doing. So some of the biggest differences between the military's TCCC program and the civilian TECC program is in the civilian TECC program as law enforcement officers, we have a significantly reduced scope of practice as well as a significantly increased scope of liability. And so that limits the type of treatment that we are able to do based upon that increased liability and reduced scope of practice. Also, our patient populations are different. In the civilian side, we need to be able to make sure that all of our medical treatment can be done on a variety of different casualties, everything from juveniles all the way up to the elderly, obese patients to patients with medical problems. These are unique considerations that are commonly only found in civilian settings. Our transportation assets and difference is going to be different between the military and civilian setting as well. In the military, when we have a casualty, we oftentimes have to transport them an extended period in time to a higher level of care. Meaning the medical treatment that we do needs to be far more complex because we're trying to stabilize them for an extended period. However, in the vast majority of situations that law enforcement find themselves in, typically our EMS partners are able to be on scene within a matter of minutes, and the transport time to a trauma center is significantly reduced, anywhere between 15 minutes to maybe on an extreme side, an hour. So the type of medical treatments that we do is significantly lower because that time gap that we're trying to fill is being compressed and reduced. We also have drug usage in the population that we have to factor in. Both illegal as well as legal drug use, how does that affect our medical treatment? And are we able to do the same medical interventions on a patient that is on blood thinners versus a healthy patient? And then the biggest difference between both the military and civilian patient or audiences is going to be the first responder training and experience. In the military setting, we're able to do extensive training because our primary mission is preparing for combat deployments. However, in a civilian setting, we're not able to dedicate the amount of training time and assets because we have a job that we have to do. And so the amount of training that civilian law enforcement officers are afforded is significantly reduced. So we want to make sure that the type of medical training that we're doing is able to be done more efficiently and able to be recalled with less refresher training than what we would normally see in a military type of setting. And so because of these similarities and differences, we realized that the lessons that were learned by the military in the TECC program and in the battlefield studies that were done, while they translate over and they're comparable in civilian settings, there's a lot of differences. So we needed to come up with a unique program that took the lessons learned from the military but adapted it to the differences and the new scope of practice that civilian law enforcement finds themselves in. And that is where the TECC program was born from. So it provides a set of guidelines and recommendations on the type of treatments that we need to be conducting. It accounts for the differences in the patient population as well as the reduced scope of practice that law enforcement finds themselves in. And the primary goals within the TECC program are only really to fill the gap until we're able to get this casualty to a higher level of care, to buy them the critical time, to do the medical interventions necessary, to buy them the needed time until we're able to get them to a more appropriate person that is able to actually treat those injuries. And then to expedite that transfer process to the higher level of care. So we're trying to stall out death and then compress that time as much as possible. So knowing that our primary goal is simply to fill that time period until we're able to get this casualty to a higher level of care, we want to make sure that our TECC training is focused on the primary wound types that are going to be encountered by law enforcement in tactical trauma settings. So our training is going to be focused on being able to control massive arterial bleeding from the extremities, being able to deal with any sort of penetrating trauma to the torso that's going to potentially lead to that tension pneumothorax, and then being able to maintain a casualty's airway due to shock or foreign object. These are the three things that are going to kill our casualty in the most rapid manner, typically before we're able to get them into a hospital. And so this is where we're going to focus. Our primary emphasis in the TECC program is dealing with these three injuries. Hopefully now you have a better understanding of what the Tactical Medical Training or TECC program encompasses, so you understand how to focus your training on the areas that are going to benefit you and your casualties the most. Thank you for your time. If there's anything that we can do to assist you, or if there's any questions that you have, please do not hesitate to contact us. And as always, be safe. Thank you.